Have you ever taken medication after medication wondering why they don't agree with your body? Well, this might just explain it. See, during research studies where these medications are tested, investigators need to make sure that it is the drug that's having the effects and not something else. To do that, they need to try and make sure the different treatment groups are as closely matched as possible on things like age, height, weight, smoking status. But even after eradicating polio, there was one thing that researchers thought was too complicated to deal with: the female menstrual cycle. I wish I was joking. They thought, among other things, that the changes in these hormones would make it too difficult and resource intensive to match the treatment groups, so they simply excluded women for research. For not months, not years, but decades. They assumed that if a drug was safe and effective in males, then that would also be the case for females. It wasn't until 1993 that females were mandated to be included in research studies, even though newer research is showing that they have no more variability than males on physical and behavioral traits when studies are designed correctly. In fact, males can even have their own hormone spikes with a daily cycle and with changes to their social hierarchy and dominance status. So some of the drugs that we still use today were created with males in mind and females being an afterthought. So it's no surprise then that we know females are more at risk of having drug side effects, those side effects being more severe, and all for therapies that can be less effective. Even today, more than 3 decades after the changes, females still have only made up around a quarter of participants in phase 1 trials during some periods. It's not good enough. If we're to close the knowledge gap, then females need to be represented in research as equally as they are away from the lab.